Hi, I'm Dr. Kate Wulster, and I'm an assistant professor of diagnostic imaging here at New Bolton Center. So as a radiologist here at New Bolton, my main focus here right now is with the advanced imaging modalities, so CT and MRI, and now our newly acquired CT robots. The other modalities that we have are similar to other places. We have radiography, we have ultrasound, and one of the main jobs that I have now is to sort of organize the multimodality approach to patient care using our advanced imaging modalities in collaboration with other services. So New Bolton has experts in surgery, sports medicine, all of the modalities recognized by the AVMA, and the way that I work with them is actually to organize the most appropriate test for their patients. So we have a lot of very complicated cases, and sometimes it's not completely clear what the best modality might be for working up a certain condition. So I work with some of the services to determine maybe whether an MRI is actually the best first test, a robot CT, maybe ultrasound, and in addition to that, provide expertise particularly on the more advanced modalities in terms of the actual case interpretation. Our surgeons and sports medicine clinicians have a lot of expertise in the more traditional modalities, so radiography and ultrasound, but I'm sort of a bridge between the more advanced modalities and the expertise that we have from the other services already in senior clinicians. And we work very closely with them in terms of their more complex lameness workups. Anytime any of their sports medicine cases needs an MRI, we work very closely to make sure that whatever abnormalities we find on the MRI really fits the clinical picture of the horse, and so that we can give them the most accurate diagnosis and that the horse can be the most appropriately treated. Because a lot of these horses have long-term lameness or complicated lameness with more than one area affected, and it can be difficult to determine what exactly the main problem is for that animal, or if the horse has multiple issues. Our Equine robotic CT system, and this is used primarily by the hospital to work with patients in a minimally invasive way so that we can look for occult injuries in sport horses and racehorses in particular. This has been instrumental in demonstrating some previously unknown pathology associated with the palmar condyles and racehorses, also incomplete fractures of various bones in the feet of horses, and it's really going to be a game changer in terms of minimally invasively working up lameness in sport horses. And my role with the robots is that of facilitating the acquisition of the images and making sure that we're providing good diagnostic images, so images of high quality that can give an answer to these owners that would not be comfortable having the horse anesthetized, maybe for various reasons about concerns about recovery, etc. That we just want to minimally invasively do this procedure. It can be an outpatient procedure with just a little bit of sleep. So during the approximately 30-second scan, my role is to make sure that the scan is going to be of diagnostic quality, that the horse isn't moving a lot or is moving within a range that our motion correction can correct for, essentially. And we then take the images, we import them into a computer, and similar to any other CT, we then go through all of the images, identify any of the abnormalities, and then communicate those abnormalities to the surgeon or sports medicine clinician in order to identify the most appropriate treatment for the animal. I'm from Hunterdon County, New Jersey, which is kind of prime horse country in New Jersey, and I grew up competitively horse showing with my equitation horse. That was then a junior jumper, low junior jumper, and I competitively rode throughout high school and then also in college. I went to Tufts University for undergrad, and then I went to veterinary school actually here at UPenn, and I think even before I went to veterinary school, I knew I wanted to do actually human radiology, and then it was actually during college that I decided that I wanted to do veterinary medicine, and so I just sort of married the two of those things. I worked at the Rutgers Research Equine Science Center during my undergrad times, and I learned to run horses on the treadmill there, and that was actually how I was first introduced to New Bolton. Was hired as a sports medicine intern during the summer where we ran horses on the treadmill. And I was hired by the late Dr. Ben Martin, pretty much because of the experience I had with running horses on the treadmill. So after I had that experience, I met Dr. Elizabeth Davidson, who was one of my mentors during vet school and during my internship. I also completed my internship here because of the amazing sports med and the sports medicine caseload. And after that, I just knew that I wanted to do an imaging residency, and so I applied for that and was accepted to go to Tufts University to finish my residency, and now I'm back here because I love New Bolton. So why New Bolton Center? I guess it's a combination of many things, both professional and personal reasons. Mainly just I really got to know everyone quite well as a student and as an intern, and I really valued the connections that I made during that time and the ability to work with all of these wonderful people who are experts in their respective fields. They've been very welcoming so far, and we have a great relationship that's recently started. In terms of other reasons, the caseload at New Bolton is really second to none, particularly at an academic institution. We have very dedicated owners. We have a dedicated hospital director now that really has focused on imaging, and she recognizes the importance of how imaging is going to change the face of equine sports medicine. My interest in imaging itself was from a fairly young age, and then given my experience with elite equine athletes, that was sort of the impetus for me wanting to choose to do just equine radiology. It's very uncommon. I would say the vast majority of people that do imaging and become board certified in imaging are small animal focused. They work in private practice. So it's very uncommon to have someone go into academia, and to go into academia and be interested in equine radiology is quite uncommon. There's probably fewer than a dozen of us in the country, and it's a very close, actually collegial group of people. I've had many equine radiologists reach out in support of coming to New Bolton, and the community is very excited. So for short-term goals, the main focus we have right now is improving and validating the Equimagine robot CT system. The idea there is to allow for earlier detection of illness and injury in horses, and in doing so decrease disease or death and that sort of thing. So that is the main short-term goal for the robots. In terms of long-term goals, what we'd really like to do is establish New Bolton as sort of the center of equine imaging on the East Coast. And we're going to have, the most state-of-the-art modalities, the most state-of-the-art diagnostics and treatment, and we're going to combine all of those things using both the robotic CT and advancements in other imaging modalities.